were talking about how it takes a village to treat these wounds. So when you come for an assessment at the wound care center, we're going to do a thorough review of your history, your medical history, a review of systems, check you out head to toe, see what kind of underlying conditions you may have that's preventing that wound from healing. And then we're going to start involving anybody else, any other specialties that might need to take a look at the wound itself or take a look at you. So like things like diabetes, peripheral arterial disease, cancer, all of these types of things require specialists. And we're able to, at the Wound Care Center, identify which specialists need to be involved right away and coordinate that care for the individual. So, dare I say, a one-stop shop, so that you're not trying to figure out who needs to see this wound first in order to get it healed up. So we're talking about podiatry. Podiatrists are very important in lower extremity wound healing. We're talking about cardiology. I would say that that is probably the number one reason that wounds aren't healing, and that's lack of blood flow. And that can happen for various reasons, trauma, disease. And so we will identify if there's potential that you're having a blood flow issue, and we'll bring in cardiology to do an extensive exam, do any intervention that might be necessary in order to get that blood flow going, because obviously without blood flow there is no delivering oxygen to the wound, and without oxygen tissue dies. It's as simple as that. Some of the other folks that we enlist in your care plan, we're going to work closely with infectious disease as well. They are able to identify some more advanced infections. It's something that just a typical antibiotic isn't going to knock out. Bone infection, for example, osteomyelitis. So we will arrange for a bone sampling, and then that infectious disease doctor can then identify which is the best antibiotic for that particular infection. And we're also looking at comorbidities, if there are any cancer issues that you may have, kidney dysfunction. That's going to determine what kind of antibiotic is going to be beneficial for your wound. Imaging is very important. Imaging, we need to be able to see what's going on underneath to help identify any underlying conditions. Again, any abscess, any infection, any bone involvement that may be preventing this wound from healing. So that's what we do. We really make your life easier by doing this complete care plan and identifying the different specialties that we need to get involved and do that for you and get those things lined up for you, and then communicate with those physicians in a timely manner so that things happen on time the way that they're supposed to. There's no big delay between one specialty and another that may set you back. So that's the village that we speak of. We also are enlisted by a lot of specialties to help with their patients, such as dermatology, urology, oncology, all the ologies and ologists. Vascular, of course, is going to send us some of their more complex wounds, so that we're able to deploy our specialties, which our advanced modalities include sharp debridement, skin substitutes, different types of biologics, as well as hyperbaric oxygen therapy. Both of our centers are anchored by Hyperbaric Health Services, hyperbaric oxygen therapy services, and that is like the gold standard in wound healing for those qualified wounds. We also get involved with negative pressure therapy and And then we do venous stasis, requires different pressure wraps, so we'll be able to install those for you as well. Offloading shoes, if those are required, we'll get you in the right boot. Total contact casting, many tools in our toolbox. So takes a village. The important part is to get on it quickly.